Okay, Isabella, can you lift your head up for me? Down, to the left, to the right. Gotcha. Patient's range of motion is appropriate. Patient's temperature is appropriate. If we were in the hospital setting, I'll use a blood pressure cuff to test your blood pressure, a pulse oximetry to test your oxygen levels. I'll check your breathing for your respirations. Okay, now I'm going to take a look at your abdomen. Would you mind laying flat for me?
Sure.
Okay, gonna lift up your shirt a little bit. Okay, patient's skin color is appropriate for ethnicity. Patient's apical pulse is not obviously seen. No signs of wounds, rashes, or any lesions. And I'm gonna take a listen at your bowel sounds. Gotcha. Gonna start at the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Bowel signs are clear, no signs of any distension. It's going to palpate lightly for you. No masses, do you feel any tenderness? No tenderness noticed, no masses, no signs of any distension. Gotcha. Can you sit up for me? Gotcha. Can you press down on my hands for me? Okay. Gotcha. Patient strength seems to be appropriate. Can you push out for me? Strength in the lower extremities and upper extremities seems to be appropriate. Can you move your arms above your head? Down, behind your back. Patient's range of motion seems to be appropriate. Muscles are intact. Size and color are appropriate for ethnicity and body stature. Able to feel biceps and triceps bilaterally. Gotcha. Could you get up and walk for me? Can you give me a straight line? Patient's gait is good. Gotcha. It's going to assess your pulse for you. Your jugular gastric pulse. 2+. 2+ by 11. Going to inspect your radial pulses. Pulses are 2+ and even bilaterally. Gotcha. Can I get you to stand up for me and close your eyes? No noticeable signs of any swaying. Romberg test is passed. Okay, you can sit down for me again. Gotcha. Can you close your eyes for me? Touch your nose. Touch your mouth. Ears. Forehead. Gotcha. Patient senses are appropriate. Okay, and if we're in a hospital setting, I will get you to close your eyes. Put your left hand over and look at the wall and be able to read for me off the list of words. Same for the right eye, bilaterally. That will test cranial nerve number 2. You already tested cranial nerve number 1, which is your olfactory nerve, for the sense of smell. You were able to tell me that it was lavender. We're going to test your oculomotor nerves. Gotcha. We've already looked at your pupils, making sure they're equal, round, and resistant. We're going to test cranial nerves 3, 4, and 6. Okay, can you stare straight for me? Gotcha, perfect. Can you follow this pin for me? No signs of any tremor within the eyes. Can you tell me how many fingers I'm holding up?
3, 2, 2, 2.
Gotcha. We've tested for cranial nerves 3, 4, and 6. Boop. Gotcha. Can you bite down for me? Touch it for your cranial nerves, facial nerves. Smile and frown for me. Gotcha. Okay, I'm gonna whisper some things and you repeat it back to me.
Welcome to Oxnard. Welcome to Oxnard.
Cranial nerve 8 is intact. We're gonna move on to cranial nerves 9 and 10. Gotcha. Can you say "ah" for me?
Look.
Phages gag reflex is intact. Cranial nerve is intact. Are you able to stick out your tongue for me?
Yes.
Gotcha. Good. Now I'm gonna test cranial nerve number 11. Resistance. Can you turn to the side? Turn this side as well. Down. Up. Gotcha. Cranial nerve number 11 is intact. Can you stick out your tongue for me? Cranial nerve number 12 is intact as well. Now I'm going to test for your reflexes. Okay, just move on slightly. I'm going to test for your brachial reflex, bicep reflex, bilaterally, tricep. Gotcha, turn it on this way. Brachioradialis. Brachioradialis bilaterally. Patella. Okay, can you get up on the couch for me and turn around? Gotcha. Achilles was assessed bilaterally. Okay, can you hold your feet up for me? Going to text for your doralis pedis pulse. Down. Gotcha. Pulse is 2+ and doralis pedis and is bilaterally. Okay, Isabella, I think that brings us to the completion of the head to toe assessment. Do you have any further questions for me?
No, not today.
Are you in any pain? Anything I can do for you, make you more comfortable?
No, thank you so much.
Okay, well, Isabella, thank you for coming in. I think that brings us to the completion of the head to toe assessment. I'm going to perform some final hand hygiene and I hope to see you back soon.
Thank you.